Okay, time for letter number 2. So, as I said in letter number 1, what I'm doing, I'm just going to make a couple videos. I'm not going to put them on YouTube. Well, they are, but they're unlisted, so nobody can see them unless they have the link. So nobody outside of a group will see your letters. So that's what I'm going to do. Now, I'm not going to look at the case notes, as I mentioned in the previous one. If your writing is good, I shouldn't need them, as I mentioned. So what I'm going to do, I'm going to look at your letters as if I am the recipient. So I'll be looking for a clear statement of purpose. For content, I'm not going to be looking at the case notes, so I don't know if that's going to be appropriate for me or not, but I can see conciseness and clarity, layout, the logic, the structure, and the grammar and vocab, so I can have a look at those. Imagining as if I were the reader. Is that something that you can actually do? When you make a letter, or when you write a letter, I should say, you should put yourself in the shoes of the reader and think, okay, if I were the only person reading this, and I didn't have access to any case notes, does it make sense? Is it clear? Is the purpose clear? Am I sure about what I'm being asked to do? That's what you should be considering. So, I'm writing to refer Andy Williams. Now, okay, right. Now, as I mentioned in the group, it's not childhood obesity. He's not a child, he's 65. His obesity started in childhood, and he's been gaining weight ever since, but it's not strictly speaking childhood obesity. It's his ongoing, continuing obesity since childhood. So, regarding his weight history, or medical history, gaining weight at every decade, well, during every decade, for which he had participated in commercial and medial. What is medial? You mean remedial weight loss programs? So has been gaining weight. So he participated in a weight loss program. However, he regained the weight. So that doesn't make sense, right? So in terms of structuring of sentence, so he's been gaining weight every decade, which participated in commercial and medial weight loss programs. However, he regained. So does that therefore mean that he lost weight while taking the programs? So he was unsuccessful, in other words? Because how this reads, and you didn't say that he actually, so you haven't told me if these programs worked or not. You say he's been gaining weight, he's taken part in some kind of programs, so does that mean that he did lose weight, however he put it back on? Because that doesn't make it clear. He takes 3 meals, well, he eats 3 meals in a day. The largest, if it's a superlative in the definite article, the largest, the smallest, the best, the worst, etc., is dinner at 7 p.m. and his fast food intake is 2 times a week. You mean is twice a week? Initially, Andy Williams, right now, you would put Mr. Williams. So, you mention his name at first, Andrew Williams. Okay. Then, Mr. Williams, Mr. Williams, Mr. Williams. Then, pronouns. So, why do we put his name again? We know his name, you've told me. Initially, he was not willing regarding surgery. I mean, he was not willing to undergo surgery due to complications of bariatric surgery. What complications? What you mean? He's had bariatric surgery before, but you said he's not willing to have any. So what, due to, you're talking about potential complications or the potential complications? That's not very clear. His current weight is 155 kilograms. So why would you put that right at the bottom like a short add-on sentence? Wouldn't you put his weight at the start here? Regarding his weight, history, his current weight is 155 kilograms. He's been gaining, you know, I would have probably put it there, not right at the end as a short, unconnected sentence. Right, Mr. Williams. Is that type 2 diabetes mellitus? Now, you mean he doesn't have it now? Because that's what that means. Has had. In other words, he doesn't have it now. Now, I'm willing to gamble. I'm willing to gamble here that he still has it. Just a gamble. So, he has. Or if you want to use present perfect, has had, and you have to put a date, since 1980, blah, blah, blah. I don't know. So if you want to use present perfect, we need to know when, or he has it now. Okay, so either he has it now, or he has had it since a particular date. Okay, but simply using has had implies that he doesn't have it anymore. Hypertension, you don't spell hypertension like that, you spell it with an S, hypertension, gout. Family history is noticeable for obesity and gout. Please note, Mr. Williams. Reporting. Reporting to whom? To whom has he been reporting? You mean he has been reporting depression, or he has been depressed, or suffer? Well, we can't use suffering. He has been depressed, or he has been, you know. But using reporting as your verb leads me to ask, reporting to whom? Related to the financial crisis. Now, presumably, I think I've got something to do. I'm not sure about the case notes if I'm what kind of doctor I am, but if I'm a surgeon, and I think I might be, because surgical options, what does this have to do with me? Indeed, what does this have to do with anything? Now, if you were going to use it and say, this is possibly one cause of his overeating, because depression has made him turn to food, okay. But simply adding that sentence, I've no idea what the significance of that is. Mr. Williams is keen to know. What surgical options, if needed, what the surgical options are, if needed. It's not very clear. Who knows what is needed or what they are, or he's knowing, I don't know, it's not very clear at all. In light of the above, we don't usually say in view of the above. Now, you need to restate your request. Oops, that's for the IELTS test. Here we go. Your purpose, right? So your purpose should be introduced early on, clearly expanded on later, often near the end of the document. which I mentioned in letter correction number 1. So this needs to be restated at the bottom. Restate your purpose. In view of the above, I would appreciate it if you could assess, manage, advise Mr. Williams on surgical options, something such as that. Okay? So, quite a few things that need to be corrected here. So, I hope that helps.